very first session, and really it was an opportunity that we wanted to come and just be able to share, I guess, some of the work that we've been doing, and some of our projects and programs. And we've had a lot of people asking us just a little bit more about, I guess the inside of GDI Hub and what we do and how we do it. So we thought it would be a great opportunity just to share a bit of that knowledge, and just have a bit of a discussion really about disability innovation and what we've been doing and what some of our brilliant partners and contacts globally are working on at the moment. And I guess also just to give you all a bit of an opportunity to hear a bit about the kind of stories behind the innovations and the people behind the products, and I guess some of the journey. I think a lot of what the Global Disability Innovation Hub does is really that innovation journey and working with lots of different people in quite a collaborative way to achieve that. So it's a space for ideas and reflections, and we're going to be aiming to do one a month, and looking at all sorts of different topics. So again, if you have any ideas for topics that you'd like us particularly cover, then do let us know. And we'll also be really appreciative of any feedback or thoughts you have on this session. As I said, it's a little bit of a pilot, so it's a trial for us as well. There'll be things that we'll learn that we can do better. So yeah, we do hope you enjoyed the session. And I guess just to give you a tiny overview of the Global Disability Innovation Hub, so we are a research and practice centre, and we're very much focused on driving disability innovation for a fairer world. We're both a community interest company and an academic research centre as part of UCL. And we were born out of the legacy of the 2012 Paralympic Games, and we're now working in 15 countries, and we're kind of expecting to reach 9 million people by 2020. So that's just a really top line overview of who we are. I know quite a lot of you who have joined us today already work with us or work alongside us, or kind of been involved in our past, and as we've developed. So what I'm going to do now is just do a really brief introduction to the individual panelists that we have joining us today. I'll also leave them just to explain a little bit more about themselves as they tell you a bit about their area of expertise. But we have Professor Catherine Holloway, who's the Academic Director of the Global Disability Innovation Hub. We also have Bernard Chara, who's the Director of AT 2030 Innovate Now. We have Dr. Maria Kett, who's Head of Humanitarian at GDI Hub. And we have Ben Alfrey, who's a Research Fellow at the GDI Hub and Institute of Making. So I'm going to hand over to my colleague Kathy now to just start to give a bit more of an introduction on disability and COVID-19 and just some of the topics that we'll be covering today, really.
Yeah, so it's my great pleasure to welcome you all, and thank you. I looked through the participant names and realised that there's some good friends as well as some new names and faces. So thank you for taking the time out of what I'm sure is a busy schedule. I'm really excited to be able to host the event today and to talk through some of the work we've been doing. And you'll see that a lot of it is very much GDI Hub focused today, but we're hoping in future sessions to open up to partners. So do get in touch if you have ideas for what you'd like us to contact or the content you would like us to use. So today we're going to talk about assistive technology and the provision parallels. And what do I mean by provision parallels? I mean that what we're seeing in COVID, the problems with getting devices to people to help them overcome the impact of COVID. So like ventilators or CPAP devices or personal protective equipment, those supply chain issues, so those market failures, they are things we've been seeing in the assistive technology world for a very long time, and we knew they existed, but COVID is now giving us a chance to measure them in much more rapid timeframes, but also look to learnings that we can use to reinforce what we know about AT and make AT systems more robust. So Ben's joined us and he's going to talk a bit about that. I'll mention a little bit more in a second. And the value of collaboration and innovation. So Bernard Shearer will talk us through the process that we've had in Innovate Now in part of the AT 2030 program in Kenya. And that has gone from being a physical accelerator to being a virtual accelerator. And there's been a lot of interesting pivots around COVID in that space. And finally, stigma and the exacerbation of inequalities. So anybody who knows anything about disability knows that stigma is one of the primary factors that holds back a fairer world. And we will hear from Maria Kett about what we can learn from Ebola and hopefully stem some of the problems that we're beginning to see in COVID already. So with that, I'll ask for the next slide. I'm going to check that I'm being slow enough for the BSL interpreters as well, because being Irish, I'm prone to go a bit too quickly. So apologies if I am, do put your hand up and let me know. So you'll see here there's 5 bullet points. And really all I want to get across today is disability and the COVID-19, the impact of it. I might be stating the obvious, but I think the first impact has been on people who need assistive technologies and services. And it's not just assistive technologies, but services that provide access to information, education, employment for disabled people or persons with disability have been severely affected by COVID-19. And some of those services have innovatively shifted to, for example, digital platforms that we're using now to try and alleviate the problems of the physical problems. And that's great in some respects. So for employment, that's brilliant. We in the disability space have been shouting about being able to work remotely for a very long time, and we've been told that it's impossible, it can't be done. And now all of a sudden overnight, everybody's working from home and there's no problem. Apparently there's no regulatory issues and there's no issue whatsoever. But on the other side, a lot of people with disabilities are still being excluded from services because they don't have access to digital platforms, they don't have access to the internet, and they don't have the training to use these systems. So we're seeing both good and bad. And I suppose the third thing is that assistive technology still remains the poor relation to healthcare technologies and education technologies and other innovations. And so it's almost even more left behind. So as part of the UK aid funded 80-20-30 programme, we have pivoted, and I'm going to talk about how we've pivoted to help support COVID-19, but we've also dug our heels in a bit because we want assistive technology to keep that main space. So programs shifting to support the response. As I said, you're going to hear from Ben, but a lot of the work, some of the work we had done in the assistive technology space under 80-20-30 and more broadly under GDI Hub work was looking at circular economies and local production, local solution methods to overcome things like repairability and making sure that the devices were fit for use in the context in which they're used. And we're seeing that we are able to share that learning of the importance of local solutions and repair with people that are doing COVID research now, so with the COVID action team, which is also a UK aid funded programme. And then we will be able to strengthen our knowledge of those systems, local solution repair solutions, and hopefully leverage them for increased assistive technology knowledge and insights in the future. So the third bullet point I just missed out, which was collaborative approach to global solutions. And GDI Hub has always been about accelerating disability innovation for a fairer world. And I suppose my only point here is that you can't accelerate by yourself. So we've always known that collaboration is absolutely key, and we look to colleagues and other projects and programs to help us create those collaborations. And I'm delighted that, for example, Ben can talk to how we're collaborating with COVID Action and with our UCL colleagues in the Institute of Healthcare Engineering and Institute Making later. And also Maria can talk about her collaborations, and Bernard too. So I think with that, I will hand over to Bernard to tell us all about Innovate Now, which is one of my favourite projects.
Thank you, Kathy. I hope you are all well and that you can hear me perfectly. So my name is Bernard Chira, and I lead Innovate Now, which is part of the Spark Innovation sub-programs in the larger 80-20-30. And I'll be talking to you a little bit about our journey and how we have evolved, since COVID-19 pandemic. So I just want to introduce Innovate Now, which is literally Africa's first assistive technology accelerator program. Now, for some of you who may not know, Africa is now home to close of 600 innovation hubs, and for a long time, disability innovators and those trying to tackle disability haven't had a place. So it's really an exciting platform, and we received really good feedback on this. And what we provide at Innovate Now is an active learning program where our innovators learn as they do. We also have mentorship, and we leverage on the large network and partnerships that we have at 80-20-30 to bring in expertise across multiple fields. And one of my favorite concepts that we have is live labs, where we work directly with persons with disability in the innovation process, and they are able to participate by giving input and also participating in testing. And we also host events and demo days to give our innovators a platform to showcase what they have to the world. And I'll speak a little bit about that as we go. So we launched our first cohort in December of last year, and it was an exciting event because it was on the Day of Persons with Disability, and the theme for that year actually aligned very well. So Innovate Now first cohort was a very in-person, intimate sessions. We had workshops with mentors and office hours, as well as the live labs that I mentioned. And these are our 5 brilliant finalists that came out of our first cohort, where we had a demo day earlier this month. And what I wanted to mention about these 5 brave startups is that they are really driving the disruption around assistive technology in Africa. And they are working across, energy, mobility, visual, and these startups have literally shown us that, in the midst of, very little resources, a lot of innovation can happen. I'll be speaking a little bit about our winner from our first cohort. So how does a digital shift look like when it comes to supporting entrepreneurs? So literally every accelerator program in the world has had to go back and relook at how to support startups during this time. So for us, COVID-19 also caught up with us toward the end of our first cohort, but we were able to actually shift our model, and this was very useful for purposes of continuity. And our demo day and pitch event was live on Zoom. We had more than 60 participants, and our judges used tools like Google Sheets to rate our presenters in real time. And we used a wonderful, concept of Slack for networking and showcase, which is very hard to replicate online. But we're very happy with the engagement that we got. So what are the benefits of a digital shift when it comes to supporting innovation? I'll share some of the benefits and challenges. Obviously, you buy location and physical barriers, and this is really important, I think, when it comes to disability, because it's a global problem. And I think it's also extremely scalable. I think being able to run programs that support entrepreneurs virtually means that they can be replicated much easier than physical workshops. And of course, continuity. Many businesses have been affected and had to close down, but we're lucky to have been able to shift to digital, ensuring continuity of our program. And of course, safety. And I mean, safety is really the topic during COVID, because you're able to enforce that social distancing. But I think for me, from an innovation perspective, the beauty also is how you're able to analyze and track. And to the challenges, of course, it's really difficult to replicate the quality of human connection and the experiences that you have. And also technology has been a challenge. We have, internet connectivity, challenges, but these are challenges that we can actually overcome. And most importantly, when it comes to disability, is digital accessibility and ensuring everyone has access. Move on to the next slide. So I'm very excited to speak about our next cohort beginning on the 21st of July, and this is going to be entirely virtual. So we're really looking forward to this new experience and to see how we can deliver value to our entrepreneurs. We've actually just finished our selection process, and we'll be coming, we'll be announcing our second cohort real soon. Next. So I just wanted to leave you with this thoughts around, innovating in challenging times. And I think we've seen for us, the power of innovation, inclusion, resilience, and agility in terms of being able to survive a pandemic. But I feel like these are literally, the values and the ingredients of being able to persist. And thank you very much. I think that should be my last slides.
Wonderful. Thank you very much, Bernard. I think it's been really interesting hearing from you and also Kathy, and just some common themes that came through there around, I guess, some real benefits that are coming through from delivering programs and projects virtually, and the impact that can have on their potential scalability and reach, particularly kind of geographically, but also then looking at that accessibility element as well, and how actually by moving digitally and by shifting some of these programs across some of the kind of innovation focus elements, but I guess also wider across, I guess, kind of teaching and learning as well, about how that digital accessibility can be really beneficial in some respects, but also can have its challenges as well. So thank you very much. It's been really interesting hearing that. I'm now going to just hand across to my colleague Maria, who's going to introduce herself in a little bit more detail, and talk to you a bit more about her work and focus on humanitarian.
Great, thanks Louise. So hi everybody, I'm Associate Professor of Disability and Humanitarianism at UCL, and I've been around for a while now, and I guess I know most of you or many of you. So I want to talk a little bit about some of the work that I've been doing that I think has a lot of bearing on COVID-19, and I want to talk about a project that we did funded by DFID between 2014 and 2017, which was looking at the impact of the access and inclusion of people with disabilities, and looking at multidimensional poverty of people with disabilities in Liberia. During the course of that research, the Ebola outbreak happened in West Africa, and it had a significant impact on our work, and it offered us an opportunity to understand some of the consequences and impacts of the outbreak on persons with disabilities. So I'll talk about these learnings. I'll go through each of these and talk about them at the end. So next slide, Louise. Thank you. So for those of you that don't know, Liberia is in West Africa. It is surrounded by Sierra Leone, Guinea and Cote d'Ivoire, and obviously area that did have a significant Ebola outbreak between 2013 and 2016. Liberia itself is a poor country. It's a relatively small population, about 5 million. Conflict, many of you might remember, ended in about 2003, and the conflict had a long-term effect on the population. It's a young population and a very poor population. In terms of disability, Liberia ratified the Convention on the Rights of Persons with Disabilities in 2012. And as in many places, there's patchy data on disability. The last census, which is now overdue, gave a prevalence of 3%. The World Bank Core Welfare Indicator Survey using Washington Group questions gave a prevalence of 6.4%. Other NGO-led surveys have given a much higher prevalence, which is probably nearer the case. Ebola, over about 4,800 known deaths in Liberia. Obviously, they're known deaths. And I think the thing to say about what, the Ebola outbreak engendered a huge international response, big humanitarian response, but increasingly it was realised that it was the weak health system and weak political system that exacerbated the spread of Ebola, much more than the cultural and social practices of people in those countries. So the Ebola outbreak started to really highlight some of those existing inequalities and lack of supports in communities. I think although Ebola and COVID are very different, I think there are some similarities in the responses. And I think also there has been some sort of work that talks about the preparedness of West Africa, in part because of their Ebola experience, to manage and deal with COVID-19 better. In Liberia, there have been known to date probably about 1,000 cases by now, of which about 47 deaths according to the World Health Organization. A state of emergency is in place and cases are rising. Evidence would suggest from certainly social media and our research partners that people with disabilities are unfortunately experiencing COVID-19 outbreak in a very similar way to how they were experiencing the Ebola outbreak, that is to say in a not very inclusive way. Next slide, please.
Perfect. Thanks, Maria. I've just got to the next slide now. We're just going to try and slow the pace down a little bit. I think we're all talking quite quickly and learning how to best do that from a BSL and interpretation perspective. I'm exactly the same, no problem. So I'll just go to the next slide. Thank you, Maria.
So I want to talk about some of our results. This was, as I say, part of an existing project, and there are a list of references and current and future publications at the end of this. So I'm not going to explain the quite complicated survey mechanisms, but we did both quantitative and qualitative research data, which has already been published. So I just want to talk about drawing out some of the lessons that we've learned. And we know that households of persons with disabilities in areas exposed to Ebola experienced a decrease in social life. Conversely, households of people with disabilities in areas that had more Ebola actually were less likely to restrict their movements. And I think there are a number of implications and factors we can draw out from this. As one of our respondents said, if we don't beg, how do we eat? How do we support our children? The problem here is that the people with disabilities are reliant on others or themselves because there's very limited state support, despite the government of Liberia's commitments to human rights, including signatoring to the UN Convention on the Rights of Persons with Disabilities. This means that people with disabilities are more likely to be at increased risk of infection, putting themselves going out and having to go and meet other people or rely on other people. And again, this has implications for the COVID. People have to weigh up these risks. Another point about this is that relying on other people isn't dignified, again, not in line with the UN Convention on the Rights of Persons with Disabilities. Universal social protection could play a key role here, but it's not yet widely available in Liberia. And another challenge for this is a lack of delivery on promises that have been repeatedly made to people with disabilities, particularly around election times, about stuff and goods that would be provided have never been provided. And this in turn erodes trust around government and state support. And therefore, people are less likely to rely on the government for other things like public health messaging. And this is indicated in the number of people with disabilities who didn't listen to government or healthcare advisors, they listened to community leaders. That in itself isn't necessarily bad. Community leaders played a huge role in the eradication of the Ebola outbreak. However, it does mean that people might be getting their information at a different time or at a different rate. It may be less accurate, and it may mean that if people are not included in some of those more formal or sort of official networks, that may be that they're missing out on other avenues of information and advice as well. And so I think it also highlights perhaps a lack of trust in the healthcare system. If people aren't listening to the official channels, then who are they listening to? And we know that the overall respondents felt that they were continually perpetuated to be treated as outsiders and rejected and shunned. When asked about why community officials didn't think people with disabilities were listening to their information or going to them for goods and services, the responses were quite mixed. The community leaders felt that they weren't given a specific fund to include people with disabilities in their work, and that it was actually quite time consuming, and time was of the essence in getting the emergency response out. So it wasn't necessarily that people with disabilities were actively excluded, but again, they weren't actively included. And again, this is really important in some of the activities, particularly things like community level activities that were meant to regenerate the economy after the outbreak. And again, I think this has got a significant relevance for the post-COVID world. In terms of healthcare provision, next slide please. We know that people with disabilities, as with many other people, were reluctant to go to hospitals and healthcare services, formal healthcare services, much more likely to self-treat or go to traditional healers. As one of our respondents says, I was afraid to go to the hospital, so I used to buy my medicines. There are lots of implications for this in terms of using incorrect medications, risk of perpetuating or exacerbating existing illnesses, fake medications. Also, if people are too afraid to go to the hospital, it may be other implications in terms of healthcare access. We also know that people with disabilities face challenges with accessing healthcare systems even before the Ebola outbreak. For example, inaccessible hospitals or lack of sign language interpreters, additional costs for transport. And I think the overall sense from the people we interviewed and spoke to was that healthcare workers didn't really have any training about disability. And this has got a number of implications. First is that it doesn't line up with commitments to existing human rights commitments. And it means that people with disabilities, therefore, it's very ad hoc if they get treatment. And this has huge implications in terms of access to services, particularly around COVID-19. And we've seen this in other countries where people with disabilities are not prioritised on the basis of their disability. So a significant lesson to learn are the long-term and health impacts. And we know there's increasing evidence of the long-term health impacts and disabling consequences of Ebola. And we also see the same increasingly with COVID-19. We know that there are often conditions that require long-term health and rehabilitation, including assistive technology and devices and psychological support. Most of these services are unavailable in Liberia and will put pressure on an already fragile healthcare system. There's likely to be an increase in vaccine preventable diseases such as polio and meningitis and other untreated health conditions, including maternal and child healthcare services. Again, many of these will have long-term disabling consequences. We've seen this situation before after the conflict in Liberia and similarly after the COVID-19 outbreak, again putting increased pressure on an already stretched healthcare system. A fact that really came to light for Ebola virus disease survivors was the lack of a formal diagnosis. For people that didn't go to an Ebola treatment centre and get a positive diagnosis, without that positive diagnosis, they were unable to access, sorry, I should have said next slide please, they were unable to access the supports and services that Ebola survivors could access. So this is a catch-22. People were too afraid to go to the treatment centres in the first place. Therefore, they didn't have a positive test. Therefore, they weren't eligible for any of the benefits and supports. And I think we can say that there's a risk that survivors of COVID-19 will face a similar situation given the paucity of tests and support services in Liberia. A significant lesson to learn is the protracted nature of these knock-on effects on the economy and the society. We know that there's huge impacts on community cohesion, loss of education, reduced child protection, jobs and food insecurity. People with disabilities were already struggling before the Ebola outbreak, let alone the COVID-19 pandemic, yet there's very little in the way of support and social protection services. So this is going to be a cycle that's very challenging to break. And I want to underscore this because reducing inequalities is a key goal of health security. And there are several systematic attempts to address this, including the WHO-led National Action Plans for Health Security, which Liberia has completed. And it states quite clearly that they want to put adequate implementation of the action plan is expected to reduce morbidity, mortality, disability and socioeconomic disruptions due to public health threats and events and contribute to the attainment of the health-related sustainable development goals. But so far, the action plan focuses mainly on what Paul Farmer has called systems and stuff, and much less on how to reduce inequalities. And as yet, there are no obvious measures for this. And I think the quote that the county engineer from Grambassa gave us really highlights this. He talks about the hardship at all levels of the county development projects, and they were still experiencing that several years after the Ebola outbreak. So I think we can see that COVID may well have the same challenges. So, in sum, what lessons can we learn from all of this? Can we make society more equal? Addressing inequalities has been called a key technology of epidemic control. And I think this is a really important point. If we can reduce inequalities, address social injustice, it has in turn the likelihood that it will increase trust in the very government services and support. And in turn, people will listen to the advice given, and that will reduce future risk. We need to do that without shifting the blame to the very communities themselves, however. Preparedness is really key to this, not just at the community level, but at the systemic level as well. We know that there are a lot of lessons that could be learned to improve community responses, and the communities could be supported in a much better way. But we've also seen that there are gaps and exclusions in the community, and we need to be mindful of that when we're addressing these community level interventions. Again, I've already spoken about the healthcare worker training. Again, this is to strengthen the preparedness of the healthcare system. I've also spoken about the need to increase trust in the state, and the provision of social protection may be one way to do that. We also know that innovations, particularly mobile innovations or technologies, digital or mobile technologies, can be a huge opportunity, and Bernard's given us a really clear example about that. But we also know that for people that don't have access to those, it could be even further exclusionary, and we need to be very mindful that we don't perpetuate and create further exclusions. I think my final point is there are no quick fixes to all these challenges. These are deeply entrenched, and we need to fundamentally rethink how inequalities are addressed to achieve the social transformation necessary. I will finish there.
Thank you, Maria. I think that's really interesting, just to take a completely different look there at disability and COVID-19 from a bit more perspective from the humanitarian. And I think for me personally, it was really interesting is to see that balance between kind of healthcare and government and policy, and how communities are interacting with all the different mechanisms, but also to see how stigma and cultural settings also play a part in that. So I mean, that's a really interesting reflection along some of the other more, I guess, innovation focused, technology focused pieces, to see how that all sits together and how they all interplay into these relationships between COVID-19 and disability, and how, I guess, us as a group and everybody who's interested within this space can really start thinking about what these relationships might be, and what work we can maybe do moving forward as well in this space. So I'm going to hand across to my colleague Ben, who's going to talk to you in a little bit more depth about some of the innovations and the projects he's been working on, particularly around kind of COVID-19 in the last few months.
Okay. Hi. So I'm Dr. Ben Oldfrey. I'm a research fellow, and I sit between GDI Hub, which I'm sure you know, but also I sit in the Institute of Making, which is another institute at UCL, which is very interested in making, both traditional and novel methods, and materials. So my research is mostly around prosthetics and materials, digital fabrication, and how we can apply those concepts to low-income settings. So I'm going to talk to you, I'm going to finish off the presentation today and talk to you a little bit about the work that we've been doing with COVID Action. So to set the scene really, so from our previous AT 2030 work, we've been exploring in depth the benefits and pitfalls of attempting to push out new localized approaches to production using digital fabrication, things like 3D printing, so that we could move towards this more distributed model of manufacture. And encompassed in this localization, there's multiple processes that come with that, potential benefits of that approach. A major one is the increased ability to have repair services. If you've got if you're producing an item locally, then you can also very easily be sourcing spare parts for those devices. But also you have the expertise of that, that intricate device knowledge right there, and so it makes that much easier. And we know that an overwhelming majority of the lifespan of pretty much all AT is down to the repair and maintenance of that device. However, because of the way in which traditionally it's manufactured, that repair is hard to incorporate into the design, especially if we're not expecting that repair can happen. And AT 2030, we're interested in how communities approach that repair problem. So I mean, there's additional benefits. I mean, customization, which is so crucial to a lot of AT, and adapting designs to both specific user needs and local context. They all come with this, they're much more possible with localized manufacture. But it is difficult for this to gain momentum. Part of the reason for that is that because all the aspects that I've been talking about, but also about the use of local materials, in order for any one part of that, in order for any one part of that puzzle to work well, you need all of the other pieces in place, and it makes innovating in this area quite difficult. You almost need the system to be there first for you to be able to really mature that as an approach. So cue COVID, the COVID pandemic, and with this we've seen this huge problems globally of supply chains around the world, and it's hit different local contexts in different ways, and we've been looking at that. And along with that, we've had this massive global need for PPE, and different contexts have addressed this in different ways. So COVID Action, which GDI are involved with, when this has arisen to address some of these problems. So there are different themes in COVID Action. We have data stream, we have resilient health system stream, and we have local productions, local solutions stream, which I'm leading on. And we've had, for this call funded by DFID, we've had massive response. We've had 1,200 or so, 1,200 or so innovations and responses to this call. So talking about the local production, local solutions call, so we're really looking to address these supply chain issues that have come up, and addressing the need to be producing PPE across different contexts. And this is done in different ways. We've seen in the UK that the crowdsourcing of 3D printed face shields has really come through, and it's this sort of cross-sector approach to addressing that need, which has meant that we achievements have been made, and like successful rapid response has been done. And we're trying to nurture these local resilient systems in a variety of local contexts across Africa and some Asian countries. So additional, like as we're developing these local production systems, we're also seeing the fact that because of the global context that's come in, some of the supply chain issues that were previously still there, that were blocking our ability to innovate in this area for AT, are actually improving. So, for example, we've our project, a partner project that GDI Hub are involved in, Fit for Purpose, who is about upper limb prosthetics in Jordan. They previously just had huge blocks. They couldn't. It was very difficult to get off the ground, but purely because of the import tax that was placed on 3D printing filament. Because of this rapid response for PPE, some countries are addressing those and changing that import tax structure, and this could bring like huge benefits for AT. So, as we go into the long term after COVID, we're really looking to see if these systems that we're nurturing for PPE, both the local production of printing, but also other more traditional production methods, we see that there's great potential for this to be taken up by AT. And if we can capture that, there's great potential for, as I say, it's because you need this systems approach to developing these localized production systems. And if we can hold on to that post-COVID, there's quite exciting things that I think that could happen for AT as we go into the future. So moving forward, the AT 2030 innovation ecosystem with Innovate Now, and the local production systems that we're nurturing with COVID Action in Nairobi and other locations, we've got many ways that we can strengthen one another and hopefully unlock supply chains. But to best make that happen, it's vital to be understanding the stigma and inequality around disability during these turbulent times, so that progress is achieved in a holistically beneficial way. So thank you very much, and yeah.
Wonderful. Thank you, Ben. That was really, really interesting, and I think it's just, I guess for me, what really strikes home is those elements of the impact or the indirect impact, I guess, that COVID-19 can have on disability innovation, particularly around those processes of unlocking supply chains, and really just getting some of those mechanisms that weren't currently working around assistive technology to accelerate, and for them to become a priority for decision makers as well. So I think there's a really interesting space, and it'll be really interesting to find out, I guess, where we're up to in kind of 3 and 6 months time, and how those different elements have come to play, and what that impact is on the production and the availability of assistive technology, and how that all kind of plays out in the future. So thank you very much for that, Ben. I'm now just going to hand back across to Kathy, just to give a few reflections, I guess, on some of the areas we've discussed, and how they link together and draw back to that overall total, really, of the kind of innovation landscape, and kind of disability and COVID, and how all those different processes are interacting.
Yeah, so I won't talk for too long, and hopefully I'll speak slowly enough, because I'd like to get some questions coming in. So I see there's one question unanswered, but please do type your questions as I speak. You've left me with the slide as well, which says why is innovation important in addressing the wider implications of COVID-19 across the local, national and international levels. And I suppose for me, the journey that we've been on with GDI Hub has been quite an interesting one, and taking on the programme of AT 2030 was a huge challenge, and there was a lot of innovation just in setting it up and getting it going, and then trying to make decisions around whether or not we should pivot for COVID, and how we collaborate with new partners like COVID Action has been a really interesting process for me. I think the thing that really stands out across everything is the role of the fact that the highly structured systems are not resilient. We've always known that, but they're not. And assistive technology services could be delivered at a more local level, especially with digital interventions. So as part of the overlap between 80-20-30 and COVID Action, we're building a platform called Innovation Action, which, if I'm very honest, the first version of at the moment might not look very exciting, but the second version, which is coming soon, hopefully will better explain the vision of that platform. And the vision of that platform is to help amplify the kind of connections that Ben spoke about, and the connections that are needed for new innovators. So we time and time again hear about people, new innovators, or people that Ben is sourcing at the moment, who've come up with a good product, but then they don't know how to get the supply chains working, or they realize that there's infrastructure like piped oxygen or like a prosthetists that are not present, and then they don't know how to penetrate that system. It's such a difficult system to get into. And so lots of innovations fall away at that point. And it doesn't matter if that's in COVID or in assistive technology or in digital skills for disabled people or for anybody, or in livelihood programs. There's so many things where we could leverage the learning. So we will be doing that in due course. And I suppose at the other end, I'm also just struck by, if I look at 80-20-30, as I was listening, I realized, we're doing one project which is on building an artificial intelligence powered observatory of assistive technology data and evidence. And it will go through all of the evidence across the internet, all of the media representations, and pull it into one place for people and produce automated reports. But at the other end, in 80-20-30, I'm struck by the fact that our program in Sierra Leone had to pivot so rapidly because people with disabilities, they couldn't beg, and therefore they needed money for advice, for food. And so we had to pay people in food to be able to then go out and give advice for COVID for people with disabilities. And so what I'm really conscious of is as COVID happens, and as we rebound from that as a society, how we really do make the world a bit of a fairer place, so that we're not just driving the very top end of innovation, but that we are innovating right at the bottom of that pyramid to make sure that everybody is brought with us. So that is my end of my little reflection, and maybe we could go to some questions and answers.
Absolutely. So the first question we have that we thought we'd just discuss as a group today was, why is innovation important in addressing the wider implications of COVID-19 across the local, national and international level? So we just wanted really just to get the panelists' view and a few reflections on this. So maybe we'll go across to you, Bernard, just to hear about, I guess from your perspective, how you think those interplay and what it is you think the priorities are. I guess focus a little bit on the kind of the national level in terms of kind of the accelerator, but actually what is needed at the national and international level as well.
Yeah, thanks for that question. I think when you talk about innovation, really, I think sometimes this gets confused a lot. But really, at the bottom of innovation is solving problems in a new way that allows more value to be delivered. And I think when you look at the context of disability, and especially in these times of COVID-19, what many countries are now realizing is, that it's actually possible to break some of the barriers that have existed for a very long time when it comes to intervening for disability. And I think even for the first time, we are seeing countries prioritizing innovation in terms of addressing disability issues. And I'll speak about Kenya as an example. So I think for the very first time, we're seeing the government actually putting into place policy work that is going to support innovation for assistive technology and to actually make resources available. And I think what COVID is really doing is to show us that there is a lot that is possible, and that, that being able to respond to what the market is telling you, or to what the persons or the people that need is telling you, is going to be very important. That level of empathy and changing mindsets is going to be very important in terms of innovating And I think that's what I really wanted to share. Thank you.
Brilliant. Thank you very much, Bernard. Really, really interesting. So I guess really same question. Maria, I think it would be quite interesting from your perspective, and I guess from the kind of healthcare humanitarian view, I guess what is the need from those different scales, the kind of local, national and international, and where do you think those drivers need to come from?
Yeah, thanks, Luth. I hope that my presentations sort of highlighted some of the areas of need within the community in Liberia. As I said, it's still an unfolding situation, and we don't really know how it's going to play out in terms of the need at all levels of the community in Liberia is huge. The access to assistive devices or assistive technologies or innovations is very limited. So I see that at the moment, I think the drive will be at a very, as Catherine said, at a very different level of the health system. But I think what I would like us to try and learn is the longer term impacts and how we really need to start thinking, not just, and of course it's important to do the immediate work, but we really, really need to start thinking about, okay, what are the implications of this going forward in the longer term, and at what level do we need to be really thinking about innovation and device and assistive devices, assistive technologies.
Wonderful. So I'm aware that we're starting to get towards the end of our discussion now. So I thought we might move across to the second question, which was, can we emerge from COVID-19 a more equal society? So I think, Kathy, it would be quite interesting just to hear your reflections on this, and maybe if you've got any thoughts on what the priorities might be, or what we can do, I guess, within the disability innovation world to push for this.
Sorry, it came to me, wasn't it? So I think that we're starting the conversation now today. I think that one of my colleagues reflected recently to me that it's stories that change minds, not maybe facts. And I think we can start to tell the story better of how firstly, people with disabilities or disabled peoples are not only equal members of society, but brilliant members of society who are highly resilient and very innovative. And also that the space for innovation around assistive technology and around this local solution, as well as around the digital space, is really ripe for investment. And I'd call on governments to really look at this space as a ripe area for you to grow economies and to grow fairer economies, and people who are investing in spaces to really look at what can be done here. All of this, though, won't be possible unless we really engage. I think some of the beauty of Maria's research is around the engagement of users, of end users. And as an interaction design person, we can't design things without knowing the really understanding the context of use and understanding the user needs. And so we can't develop a policy or a system or a solution without talking and working with people with disabilities or disabled people. And so that's the challenge. Ben said all of these little bits of a jigsaw have to kind of come together, and sometimes you need the system to be in place. But I'd argue that there's lots of places or lots of bits of the jigsaw that could drive a solution in a different country or a different space. So I think if you have an idea or solution, then we're here to help, but there are others that are here to help. Sometimes we just connect people. That's all we do. I'll hand over to somebody else for some comments now.
Wonderful. So we've also just got a few questions coming in on the chat box. So I'll maybe just go through a few of those now before we move on to our next kind of main question. So we've got somebody asking wanting to know a little bit more about the models of change in healthcare systems and manufacturing for assistive technology, and I guess of how it's been impacted over the last few months, particularly in Africa. So I guess it's just looking at, what other economies can learn, from those experiences. So I think maybe if we come to you, Ben, I don't know if you've got some reflections, and then obviously we'll also see, I'll come to Bernard as well, but I'll maybe come to you, Ben, first and see if you've got any insight into, how those manufacturing methods have been impacted in the last couple of months, if you're aware of that.
Yeah, sure. So and Africa is a good example of where these problems that in supply chains globally that have come up due to COVID, they've really highlighted the just the fragility that comes with having this whole value chain that stretches across huge geographic locations. It brings with it huge environmental costs, and that's very much in the zeitgeist. But what we see for these product sets is it just means that you've got such a lack of flexibility to change, and with COVID's come along, that's just been made loud and clear. And the problem with such a long value chain is, like, when there's a problem along it, you can't, that value chain can't really, it can't adapt. And what happens in that scenario is just that rather than any one player in that chain that adapts, they're not in the chain anymore. New suppliers, new innovators, new buyers will come along, and unfortunately, it's usually the people at the bottom of the pyramid that are left off worse. And different countries are seeing this. So have we seen a lot, as we've seen across our call, but also more widely, what we see is happening is people wanting to manufacture in ways that will be resilient in the future. So this could be using seeing what local materials could be used to produce what they were producing before, and it could be using machinery that's more available, or it could be trying to bring in that kind of machinery to the local setting. I think I see one of the things that is interesting about all the design sharing that's happening, particularly around PPE, and it was happening before, but we already had this, digital sharing and the designs that can be passed around, and digital manufacturing techniques that don't have to be too expensive. It's interesting the way in which we can put that sort of the high tech manufacturing that is possible. It's quite transplantable to lower income settings. So there is some equalization across settings, which could be happening in the future, I think.
Thank you. It's really interesting. So I guess, Bernard, it would be quite good just to hear from you in terms of your experience, I guess, kind of within and around the accelerator, how, I guess, kind of the manufacturing of AT has been impacted. We've also had a question asking a bit around drawing on the lack of digital access, and how through innovation do we make sure that we're not leaving people behind? So it'd be quite good to hear your reflections on that as well.
Yeah. Thank you so much. I think when it comes to manufacturing and looking at AT specifically, and I think the situation in Kenya is pretty much very, very the same across Africa, is that we've seen innovators being very frugal, or being able to actually use very lean manufacturing methods. And I'll just give an example. One of the finalists in our first cohort, Lincoln, he's manufacturing electric wheelchairs, but he's utilizing a lot of circular economy concepts like recycling parts from other components to actually build new ones. And I think this has been very interesting to see that the validation that manufacturing can have in very low resource settings has already been done. I think the question is, how do we bring in new technologies that enable us to reach, or the local manufacturers to reach a high degree of accuracy and also of quality, while keeping the costs down. And I think some of the work also that has been done in relation to this by GDI Hub and some of the Kenyan organizations here is, for example, to pilot using 3D printing technologies to deliver wheelchairs and assist and prosthetics. And I think it's going to be very interesting to see how all this comes into place in terms of giving access of these technologies to entrepreneurs. And to your last question about digital technologies and ensuring that we can leverage on this to kind of bring everyone on board, I think is a very interesting case talk about, and that's why our current or second cohort is going to be focusing on how can we leverage on people that have the mobile device, especially persons with disability, to make AT accessible, and also to ensure that persons with disability really can also enjoy this same level of access to products and services that are largely being deployed digitally. And I think our second cohort is going to give us more insights on what we can do and what we can learn in terms of leveraging on digital platforms to ensure equal access. Thank you.
Thank you very much. So we're just coming towards the end of the session now. We've just got a few minutes left. So what I just quite want to do is, before we start to wrap up, I just want to open the floor to the panelists, really, just to get any final reflections or any key elements that you'd like people to take away with them today. So we'll maybe just go to Kathy to start with, and then we'll just do a quick run around the panelists, and then we'll begin to wrap up.
So three things from me: digital, and making it accessible, digital, and harnessing that. The second is supply chains and thinking about what we can do. And the third is how we adapt our systems, then our services, provision services to leverage those advantages. And I'll just say thank you to everyone. I've really enjoyed taking part. Thank you very much.
Wonderful. Maria.
We're having a digital moment there. There's lots of questions in the box about, about what we can do differently. And Tom, hello, Tom Palmer, has asked a question about what does the international humanitarian system need to change in order to deploy AT interventions in crises. And just to say, there's a piece of work going on which I'm leading on to look at what the humanitarian system does need to do. And I think, the first thing I'd say is it needs to be aware about the need to do this. And I think thinking through some of the implications, for example, long-term disabling consequences about COVID and Ebola might help to sort of focus people's minds a bit more, that we're not just talking about the need for wheelchairs or whatever. It's a much broader than that, and it's much more long-term than that. And I think the more we can try and sort of highlight the importance of it, and get people to be aware that the current system isn't effective and we need to improve it. We need to make it much more collaborative, much more coordinated and innovative. I'll finish there because I know we're pushed for time, sorry.
Wonderful, thank you. Bernard, anything from you?
Yeah, thank you very much. I think my final thoughts would really be just to say thank you and also to kind of say that I think we'll just go back to what Kathy said earlier, is that the sort of stories that people see or what people hear can have a huge impact in terms of starting to change the mindset. And I think when it comes to innovation, especially in AT, we really need to create a lot of visibility for innovators across the world, and especially in Africa and other low-income settings where we do have very innovative people that are trying to make a difference, and they just need that visibility, and that visibility should be followed up with action, such as real investments. And for me, I think I really look forward to helping my first 5 let me call them panelists from my to go on to the next stage. Thank you very
Wonderful, thank you, Bernard. I think we just lost your interest a little bit at the end then, but we got the core points. So Ben, I'll just fire across to you, just for any final reflections.
Yeah, I guess for me, maybe the overarching concept that comes to mind is just is local capacity. Local capacity to produce and local capacity to repair and maintain devices. And how they link together, but also by building that local capacity and the capacity to innovate, it gives us, if we're outside of that local context, the capacity to access that local knowledge, the user knowledge that could be incorporated into design processes.
Fantastic. So I think it's really interesting to hear, and a lot of the kind of messaging coming through is that element that actually a lot of this is really broad and it's really long term, and will be something that is going to evolve over time. So so we really look forward to, I guess, hearing a bit more about this, and something we can maybe address again in a future session, and pick up where we left off. I'm really sorry for everyone we weren't able to answer all the questions today. What we will do is after this session we'll put together a bit of a blog on our website, just summarising some of the key elements we've discussed. And we'll also provide some links to some of the, I guess, some resources and some references that we use within this discussion, but also some more information on our future sessions. Our next Disability Innovation Live will be coming up next month, and we're going to be looking at disability, stigma and the role of innovation, and that will be on Thursday the 6th of August. So we'll be providing some more information about that shortly, so do keep an eye out for that. And we've also got some publications and some other kind of opportunities coming up shortly as well. So do follow us at GDI Hub on Twitter, or keep an eye on our website, as I mentioned. And this session will be uploaded to YouTube as well, so so you'll be able to watch it again should you wish to. And finally, really, it's just a massive thank you to all the panelists and to all you for joining today. I think it's been really great just having this quite informal discussion and just hearing some ideas and some reflections. And your questions have all been really, really brilliant and really insightful as well. So, so certainly next time we'll maybe try and put a bit more time into looking at some of these things in a bit more depth and getting that input as well. So thank you so much for everyone for joining. We really hope you'll be able to join us in the future on some more of these live chats. And yeah, thank you. Take care. Bye, everybody.